Leadership Commission on AIDS. And that makes this the oldest nonprofit organization that has been focused on HIV, AIDS, and now 2 years ago, we rebranded, and we'll talk a little bit about that. So today is about maternal health equity, because we know that this month, the entire month of April, is about maternal health. And so it is very fitting that in partnership with the Afire Center, that the National Black Leadership Commission on Health is sponsoring this webinar. And I've been following a lot of what the Afire Center has been doing throughout the month because of their knowledge, their experience, and their work in the area of Black maternal health, because we'll hear a lot about the impact and what is happening in the Black community. So with that, I just like to share a little about our organization. Again, the National Black Leadership Commission on Health, we rebranded at the end of 2019. In this environment of COVID, it's hard to remember year from days now, but we rebranded at the end of 2019 after a 2-year study looking at what we do, what are our programs, and how we do that. And we fully recognize that HIV/AIDS, as all of you on the call very well know, and hepatitis C, does not stand alone, but there is an intersectionality between HIV/AIDS and other health disparities that continue to disproportionately impact Black African Americans. Hence, we now have, coming out of the rebranding, a new mission statement, which is before you. Our mission is to champion the promotion of health and prevention of diseases, to reduce disparities, and to achieve equity within the Black community. And that vision is to reduce these disparities, achieve equity, and promote health and well-being of Black communities through advocacy. We really stress advocacy because I think if nothing else, this COVID has shown us that if we don't advocate and speak boldly and consistently about our needs in our communities, they will not be addressed. Advocacy leads to policy. We need changes. We need changes in the policy. And while we applaud the verdict of the jurors yesterday in the Chauvin trial, and I think we all applaud that, and we commend and thank the jurors for standing up and making the right decision about justice. And we certainly commend and applaud the Attorney General who led this effort, phenomenal team to bring us to this point. We continue to pray for the Floyd family, for their peace, comfort, and strength. But we also know it is now a turning point to focus on policy, to focus on changes that will bring about policies that leads to budgets in order to address the changes that are needed to stop what we continue to see impacting far too many Black Americans, mostly men, but also women. So with advocacy, with policy and actions, that is where we began to see change. So within our work, we have now expanded to 8 focus areas. We continue to include HIV/AIDS, hepatitis C, As you see the focus areas on the screen, those are the 8 focus areas in which our work is now focused under the umbrella of advocacy, policy, and actions. Next slide, please. So today, as we said, the emphasis is on maternal mortality. And this is a major public health crisis that affects more Black African-American women, in fact, 3 times more than any other group. And the US maternal deaths are among the highest of any developed country and have been increasing for 25 years. So in 2014, we saw trends in the maternal mortality report that was issued jointly by the World Health Organization, UNICEF, United Nations Population Fund, the World Bank, as well as the UN Population Division, at which time it showed that the US maternal mortality rate had increased from 1990 to 2030 by some 135%. And again, Black women, the rate is double the average. And I just, again, will say, this is the same thing that we continue to see in the 8 focused health areas that I mentioned earlier that disproportionately impact Black African Americans. Causes for multidimensional to stand out as responsible for disparities between Black women and other groups include everything that we also know. Poverty. Poverty is 3 times higher among Black and Latinx women than white women. And as long as we have poverty and women are not able to care for themselves, their family, buy food, rent, get medical care, have access to medical care, then we will continue to see maternal mortality rate among this population. Racism. I don't need to speak about racism. We know it, we see it, we live it. The world knows it now, if they didn't, because COVID has uncovered it. So our work must continue in terms of keeping this in the forefront. But these are the structural drivers, as we often say, structural determinants, among others, that continue to create causes of maternal mortality, higher rates among Black women. Next, please. So, with that said, I am again so pleased to be joining Marcia Jones, someone with whom I have worked with now for at least a good 10 or 15 years on the national level. And I would say Marcia is also the person who has raised the awareness around maternal health and the work that she is doing that has now brought many more of us into the forefront in looking at maternal health. So I am just delighted to join Marcia Jones and the Fire Center, and I will introduce Sarita Burrell, who will take it from here. And we ask again, for those of you who are joining us, for questions or further comments that you may have for Marshall and her team, to just put them on the chat, and after their presentation, there will be time to answer that. With that said, Sarita, you got it.
Thank you, ma'am. Thank you, Ms. Fields. Good afternoon, everyone. I am Sarita Burrell, the Programs Director for the AFIA Center, and it is an honor to be here in partnership with Black Health to bring forth this 3-part series on maternal health, something that is absolutely near and dear to the hearts of all of us here at the AFIA Center. So, just a little background on who we are as an organization and what we do. The AFIA Center is unique in that we are one of the very few reproductive justice organizations in North Texas, founded and directed by Black women. We elevate, amplify, uplift, and center Black women unapologetically. And so our mission is to positively impact and transform the relationship of Black women with their bodies and sexual reproductive health, to foster complete mental, physical, spiritual wholeness, one that is grounded in the absolute autonomy and free of reproductive oppression. At the Afia Center, we are wholeheartedly committed to creating an atmosphere where women's experiences are the focal point of everything that we do. And so when the Afia Center was established, initially the focus was on addressing the absence of programs that would assist the needs of marginalized women who were living in poverty and who were at risk for high incidences of AIDS. And so Marcia, along with the other co-founder at the time, quickly realized that in order to tackle this dual epidemic with poverty and Black women being at a higher risk of contracting HIV or AIDS, that the organization needed to really address the needs of women, specifically Black women, on a larger scale. So in order to do that, in order to sufficiently address what was happening to Black women, they knew that a single solution was not enough, and that there needed to be more of a multi-pronged approach that would really examine the intersectional inequalities that were based in race, gender, and class. And so with that, the organization's direction shifted, and where we embrace the reproductive justice framework. And so reproductive justice is a platform that creates advocacy that is informed, self-actualized, and protects women's sexual reproductive health. And really at the core, reproductive justice is the belief that all women have the right to have children, not have children, and to parent the children that they have free from state-sanctioned violence. So using the reproductive justice framework, we approach our work through education advocacy policy, which something that Ms. Fields spoke on, and through that invokes change, right? And so while we are concerned about all aspects and areas where Black women are disproportionately represented, we also have some areas of focus, which are focus areas that we highly lift up and really are the focal point of our work. And so, of course, maternal mortality or maternal health, abortion, HIV, and the decriminalization of Black bodies. And so, to find out more about the Afia Center to get involved in some of the things and attend some of the events that we have going on, visit us at any of our social media handles that are listed there, and you can visit www.theafiacenter.org to get on our listserv. And so, next slide. With that, I will briefly go over the objectives for today's webinar. And so overall, we are hoping to deepen your understanding of the contributing factors to Black maternal health outcomes, understand the current evidence base, and identify ongoing needs of Black maternal health services, and explore the impact that COVID has had on maternal health. And to bring to bring this all home will be Marcia Jones, our Executive Director, next slide, who is also the co-founder of the Afia Center. Marcia is a grassroots organizer, community mobilizer, professional speaker, health educator, with a commitment to transforming women and girls' lives. She has pledged to the development of leadership and engagement of activism among women by challenging harmful systemic and political constructs to advance the economic health and safety of women and girls. Without further ado, I present to some and introduce to others, Ms. Marcia Jones.
Well, thank you. Well, thank you. I'm just hoping that I can live up to the standard that's been set. But it's really good to be here, and I'm always really happy to share space with C. Virginia. I like to say her name too, like C. Virginia Fields.
She always does it. She says the whole name no matter what.
And so I'm always honored to share this space. I'm always honored to any way that we get to share space with the Black Health, the National Black Leadership Commission on Health. I often say in spaces when you're moving through this work, it is those organizations who have the most on the line when they decide to align themselves with smaller organizations who've not necessarily made that mark yet, but then they will, I say, put it all on the line and align themselves and partner with, I keep wanting to say in Black, but the National Black Leadership Commission on Health is one of those organizations. There's many, but they're one of those organizations who say, you know what, I'm sitting in this space. I was invited to a space. At that time, it was 30 for 30. And I was invited into that space. It's a small, tiny organization. I was still running around with a backpack, catching buses and not too many planes because I didn't have enough money to catch planes. But I was still catching buses and, just trying to get places because I knew there were some spaces that I needed to be in. There were some Black women doing this work, and I needed to be sitting in the spaces with those women so that I could glean from the knowledge, from the experience, from all that they had brought into this space. Now, I wasn't a baby sitting in those spaces on myself. For some of you, it may be on here that know me, you probably used to see me with blonde hair, but COVID did some stuff, honey. We had to go on back to, we couldn't get to the beauty shop and all of that. And we had to really, really go back to what was natural. But I'm not a baby in this. As a matter of fact, this year I'll be 60. And so, but I was new into this work. I was new into doing it in this way, into doing it in a more organized, concise way, really being able to hone on the things because it was everything needed, but what was it that we were going to be able to hone in on? And so that was one of my introductions, and one of the organizations who aligned themselves with us, and not just in that national space, but also have been in Dallas to hold spaces to talk about things that were impacting Black women. And at the time we were talking about HIV and how that impacted Black women. So I am always super, super excited to get to, almost like a child, get to say, look at us now, And so Sarita is one of those things. Our staff is really growing at the Afia Center. Whenever I see one of these PowerPoint presentations, it really speaks volumes to who we are in this organization and how we're growing, and to be able to bring in young sisters like Sarita, who bring in a wide variety of expertise and history to really move forward the work that we are doing. So thank you, Sarita, for that introduction. But so, yeah, I'm going to just talk a little bit about maternal mortality. C. Virginia has given us a lot of data, and that data hasn't really changed. That data don't change a lot nationally, and when you look at a state like Texas. And so one of the things that started the Afia Center in this maternal mortality work was that I get the year a little off, but it was either 2012 or 2013. I had received an email from someone I was in a group with, and it was from the Black Women's Roundtable. And they did an assessment or whatever, or did a survey, and they were looking at the state of Black women 50 years after the civil rights, and then also inside of President Obama's administration, as he was in his last term. And they were looking at Black women. And so they looked at Black women's economics, they looked at education, they looked at all of these things, and they looked at health. And in many of those spaces, Black women were really moving forward, right? I mean, educated, more than one degree, entrepreneurs, just a lot of things. But where Black women were not doing their best was in our health. Black women still were not doing the best in health. And so, but the thing that stuck out for me, and I will tell you, I was really looking to see what things were going to look like with HIV, because that's the thing that's the driving thing for me. And it talked about maternal mortality. And it's in the statement, I will never forget it. And it said, for Black women in the United States, they were more likely to die in childbirth than Black women and than women in Lebanon. And I was like, what? Like, not that I'm saying Lebanon is a bad thing, but I'm like, what? And so I thought about the fact that I lived in Texas, and I thought about what maternal mortality, what HIV looked like in Texas for Black women. And I said to myself, I can only imagine what that looked like in Texas. And so around about that time, in that period of time, I had been invited to go to some different things that was happening in Austin, in our capital, around Roe v. Wade. And then I think all in that same period of time, Wendy Davis had did the filibuster and all of that. And the thing that stuck out to me was, one, we were talking about women's reproductive health rights, but nobody was talking about all those people, all those women, all those people that invited me. They were not talking about maternal mortality. And I was like, this is interesting. And then they were talking about the access of the right to abortions or whatever. But for the better part, the people who were standing at the podium talking, while they were talking about Black women, they were not Black women. And I felt some kind of way about that. I was like, so if we're going to be talking about Black women, I think Black women need to be leading that conversation. And also, if we're going to be talking about access to the full spectrum of reproductive health, we need to also be talking about maternal mortality, because it's all the same story. So that's kind of what made me jump in. And I made a commitment to do the work in Texas, because I was all over the place doing the work. At any given moment, I was in New York, I was in DC, I was in Atlanta, I was in all these places. And I was committed to do the work in Texas. And so that's what brought me to where we are now in doing this. So we did our first report back, I think it was in I want to say it was the legislative session in 2013. It was just myself and a handful of volunteers, and we gave them the best that we could give them. And from there, the report has moved on and on and on. With more resources, of course, you develop a different quality of stuff. But the core of what we were doing has not changed. And the core is, when we did that first meeting, when me and little volunteers drove down to Austin and did our first presentation to legislators and whomever else came into the room, we were saying to them, we were making an appeal. Black women in this state are dying. They are dying from childbirth. They are dying in childbirth. Their babies are also dying. And nobody is saying anything about it, not loud enough anyway. And so we wanted to get on the bullhorn. We wanted to talk about this. And so over time, we partnered with other people who provided us with more information. And then we started this. So then in 2017, we created a more reformed report. And so every other year, every legislative session, we do a maternal mortality report specifically for the state of Texas. It don't come out until May. So you all will be able to get that new report right now. If you go to our website, you will get the 2019 report. But we do have a 2021 report that will come out in May. And along with that, you will also get the state of Black women in Texas that give a more expanded view of what's happening to Black women in this state. But anyway, so as we talk about this, the data is there. It is there. We don't dispute it. Black women are like 243% more likely to die from a pregnant-related causes than white women in this state, in this country, I mean. So like, let that sit with you. 243% more likely to die in a pregnancy causation, from pregnancy causation in the United States. But yet, people in the United States are marching up and down the street saying that they're pro-life. Whose life are they pro? When Black women are 243% more likely to die from pregnancy causation. We know that Black people are more likely to die at the hands of law enforcement. We know that Black children are more likely to die within that first year of birth also. Because if the mama ain't healthy or the birthing person not healthy, the baby's not going to be healthy either. Let's be clear about that. We know that. We know that Black people are more likely to live in environments or live in communities that's environmentally unsafe, where children can't even play in the yard without inhaling, eating, ingesting in some way lead and other forms of poison in the yards. We know that. We know that Black children are more likely to go to schools where there's substandard education. We know this. We know this, and all of these things lead to that. And so what am I saying? At the end of the day, what is causing Black women to die, we've been saying this for a long time now, is race. It is race, pure and simple. pure and simple, because Black women who are well resourced are dying, Black women who are well connected are dying, Black women who are highly educated are dying. What's the common denominator there? They're all dying, but what's Black? It is Black women who have the best behavior, because when we were talking about HIV, it was promiscuous women. It was women who were sleeping with too many men. It was women who were not negotiating safe sex. It was women who were doing this. It was women who was doing that. But with Black women and maternal mortality, it throw all of those misnomers out of the window. Because the very women who are dying are the women who are doing the research on this. There are women who are bringing in the reports. There are women who have far reach to the things that one would need in order to assume that one would be healthy. When we talk about the social determinants of health, the social determinants of health states that our wealth is a direct connection to our health. So those who have more access, those who are most wealthiest, for the better part, should have the best health outcomes, right? Well, with maternal mortality, that is not necessarily the case. Black women with resources. I hate to always use Sarita Williams as an example, but we use her because we know the resources that she has. She's Sarita. And not only that, but her health, all of those things. But it's because of her being Black that her treating team, her physicians, the people who were treating her, failed to hear what she was saying, because they don't listen to us. They don't hear us when we say what's going on. That study that you all hear about is real. And it says that Black women or Black folk can take more pain. So they're less likely to be heard when they say that they're hurting. They're less likely to be administered to when they say that something is going on. We're more likely to leave the hospital in a condition that can lead to our death soon after leaving. And so we have to even go against some of the things that social determinants of health speak of. And that one thing is that your health is directly related to your wealth. Your health wealth is directly to your wealth, because that's not so with maternal mortality. Because if not so, as a matter of fact, many of the women who suffer or die from maternal health are women who are resourced, who are really, really resourced, because they don't see themselves as being at any risk, because they have all of these resources in front of them. They have good health care, they have insurance, they're married to doctors, they're doctors themselves, their circle of friends, they're all of these things. But what don't change is our gender, and what don't change is our color, who we are, our blackness don't change. And so I'm not a doctor, I'm not a researcher, I'm not any of those things. I am a regular person in the community talking about what is harming the community. And so if we are not leading this conversation with race, with gender, when we talk about white supremacy, but we have to go even further and talk about misogyny, because that thing, it makes it look differently. It is race toppled with our gender. It's toppled with that, and how we are received by society. And so how do people see Black women's lives, or Black presenting women's lives? How do they see us when we step into those spaces, when birthing folk step into those spaces? Who really cares what the outcome is going to be? Because if they're looking at our Black. So when we look at this data, sometimes the data is just way too much for all of us to understand. And so that may cause us not to want to talk about this as much as we would like to. But I would say connect yourself with somebody in your community who's talking about maternal mortality, because the data is very important. I'm a storyteller. I tell stories. I am more of an anecdotal person. We are really fortunate at the Afia Center to have some really cool data wonks in the space. We have policy people in the space, and that's how we're able to create this document that we create. But I like to talk to people. It is very important that we are talking to people. Many of the women that we are trying to serve, many of the women that you're serving, many of the women that you're going to talk to, they may or may not, and it doesn't mean that they're not intelligent, it doesn't mean that they're not educated. The data may miss them. It may miss them. Even when we're talking about implicit bias. What is implicit bias? You know, having people to understand that when you go into that space, the doctor already, or whomever the treating team already have made up their mind about who you are, why you're there, and what your outcome is going to be. And here's the thing, that's not just with white doctors, right? That implicit bias, because we're fighting a system. It's like saying there are some good police and there are some bad police. Maybe there is, maybe there's not. It is not the individual police that we're working with, we're fighting. It is the system. It is that system that's killing us. So anybody that sit in that space can be liable for killing us or harming us because they are all educated or trained using that same system. And so that implicit bias can, I didn't say it do, that implicit bias can sit anywhere with anybody who's been educated or trained in that system. And so it's important that not only are we putting out this data and that we're letting people know what's happening, but it is also important that we are pushing for policies, pushing for change, that we are talking to folk in school as they are making the decision that they want to be doctors or physicians or whatever it is that they want to be, where they're going to be caring for folk, that we then start to talk about that, changing that narrative, changing the way they see the people that they're going to meet, that they're going to care for. How do they see them? How do we change that? And we have to start it early. We can't do a 1 week or 2 week every 2 or 3 years to get a credit in implicit bias course with someone who's already been trained. Can they change? It's cognitive. I'm sure they can. Anything learned can be unlearned. But let's moving forward. Let's start that early. Let's start to push for that. Let's see what's happening in your legislative session. Let's see what's happening in your local areas. Let's see what's happening as we start to talk about changing how the medical society, how the world see Black people. The direction that the National Black I'm sorry, y'all, on health, the direction that you all are going in, that's great, because not only are we dying, not only are Black mothers dying, Black birthing folk dying when we talk about maternal mortality, but Black folk are dying with cancer. Black folk are dying from sickle cell. Black folk are dying from colon cancer. Black folk are dying. They're dying from all of these things, right? And it's not all just poverty. Most of it is how we are treated when we go into the healthcare facility. And that is because of implicit bias. That's because they see our Black before they see our checkbook. They see our Black before they see how we're going to pay the bill. They see our Black before they see our pain. They see our Black before they see any of this. And so we have to be having conversations on the ground. We have to be having conversations to the people that we talk to. We have to be having conversations. So when Christmas dinner come, for those of you who may celebrate holidays, when those times come, talk to somebody. There's people in the room. Even talk to people who've already birthed and talk about their birthing experience. What is the difference in my birthing experience with my son, who's 40, and somebody else's birth experience whose son is 4 days old? I will guarantee you that it's not a huge difference. I will guarantee you that I was encouraged to have I was encouraged to have a cesarean when I very well probably could have had a vaginal birth. I will tell you that. You know, and I'm sure with us talking, because I have a birth mother that who just delivered about 8 weeks ago, who from the time she was 6 weeks gestation, her doctor started to discuss a cesarean with her, and she discussed it every single time she came. And her birthing experience was horrible. Yes, some of it was because of COVID, but COVID didn't take away a person's ability to treat a person like a person. But her birthing experience was horrible. And we still need to make sure we are monitoring her, because there were a lot of health issues that presented itself when she was getting ready to birth. But you know where that comes from? That comes from all of the times that she was going to the doctor in care way before she got pregnant, where many of those things were overlooked. Because that happens a lot when we go to our treating physicians. Things are overlooked. And I'm not saying all the time, I'm saying many of the times. And so birthing, being Black in America, is an experience. It is an experience that should not be. When I hear those statistics, when I hear that, it feels like almost in 2005, when I first heard that people were dying on a wait list to get medication for HIV. And I was just taken aback. I could not believe that people in the United States were on a wait list to get medication, to get life-sustaining medication in a country like the United States. I couldn't believe that. And for the better part, these were poor people. These were Black people. These were same gender loving men. These were Black women. These were what society would probably want to call the throwaways at that time. These were the people we were okay with losing. And then I couldn't believe that as I sat in the class and I heard them say that. I couldn't believe that in this country, this could be. And so I feel that same way when I think about maternal mortality. I feel that same way when I look at the data around COVID. When people who are not white people are dying at such a high rate, getting sick and then dying. People who society is okay with losing. Older people, people who society is okay with losing. We can change this. We have to change this. We must change this, but we have to call it what it is. And so Black women, and I tell people all the time when they ask me, well, why is it that Black women are dying? Are they too fat? Are they not eating right? Are they, what is it that Black women are they not taking enough exercise? I know they just Black. That's all. They're just Black. Oh, no, I beg to differ. Yeah, they're Black. People are uncomfortable when I say that. Well, we have to push people to be uncomfortable enough to change it. Black people who are birthing should not be dying at such a rate that they are dying. The March of Dimes said for 25 years, and the number is going up more and more and more. So I'm not sure how much time I have left. So I want to make sure that I talk about some ways in which we are addressing what is happening to mitigate the damages or to mitigate some of the things, these situations. And so it's very important. The data supports the fact that a Black birthing team, starting with a Black doula, is very important and has shown to decrease maternal and infant deaths. Having that birth worker, that doula at the very when it's time for the doula to come in, that very important support role that the doula play, that advocacy role that the doula play, that educating part that the doula play, that voice that the doula can have for that birthing person, that voice that the doula can have for that family, and helping that family to understand some of the things that's going to happen inside of that space, and how do we make sure that our person that's birthing at this time get the ultimate, the optimal care to make sure that they leave home and that they make it home and that they stay home. And that by home, I mean alive, that they're here and that we're celebrating everybody's birthday on that next year, not just the babies or not just the birthing person, but there's a huge family celebration because we didn't lose anybody, because that person went through this process with the necessary information that they needed to support them in this. And also midwifery, not returning, but strengthening. There was a move to get rid of Black midwives systemically, but as most of Black folk usually survive it, so there were and have been and have remained Black midwives, and now a new era of folk are being trained to become midwives. And so Black midwifery is becoming very powerful again. And so it's important that we make sure that there is legislation, that there is processes, that there are things in place that will pay for these things, that will support these things, that will promote these things, and not underpay or underserve or underscore how important it is that we have this. And so Black midwifery, and so it's important having that birth team in place. It has shown, the data has shown that it improves, it increases the likelihood of that mother living, of that birthing person living, of that baby living, and not just living, but thriving, being healthy. So that is very, very important. I see Virginia is coming back, so I don't know, I'm probably running out of my time. So I did that right on time. I wanted to make sure that we talked about those solutions there. And so those are some solutions. The AFIA Center have a doula team. We have a team of birthing folk, doulas. We are in the process now of negotiating, trying to look for space. We're going to be looking to put in place a birth center. I myself is training. I've trained now to be a birth assistant, and I will be going on to train to become a midwife. And so we want to be advocates in action. We want to put some things forward. So that's pretty much what I came for, and those are some of the solutions. And staying on top of the policy, extending Medicaid for a year. That was the other thing. Extending Medicaid for a year after that person either miscarries, births, or whatever, after that pregnancy end. Extending Medicaid for a year will improve the will improve the outcome. It'll decrease the maternal mortality and increase the lives of the likelihood of that person living. So that's something you can do. You can call your legislators. You can get with somebody who's moving policy that way to make sure that we get that piece in place. So that's it.
Powerful. Absolutely powerful. And I tell you, Marcia, you have given all of us so much to think about and actions to be taken. But we do want to leave the last 10 minutes for any questions or comments in the chat. And before we go there, I just have two questions. You talked about the doulas and you talked about the midwives. How does a woman make a decision or select a doula or a midwife? How does one go about doing that?
So one of the things that Black Mamas Alliance, I believe they're in the process of trying to do, and that's put a Black doula registry together. And so that is one of the things. But I would say one of the best ways is to ask your hospital. A lot of the hospitals now are really encouraging doulas. Sometimes there are like clinic doulas or hospital, like you really want a community doula if you can get one. But that is really a good space because that's a place where people are going to go. Google, we're in the Google stage now. Google and see where there are Black doulas in your communities or in your state. There's usually a registry with Black doulas in your state. Most social media have doulas. There's Black doula, there's that. So looking out like that, kind of researching, not even researching, just kind of throwing your fish out, throwing your net out and see what you're gonna pull in. And then the most important thing is after you connect with them, talk, Ask other doulas about them. It's nothing wrong with that, asking community about them. We wanted to get to a place where you don't have to look that hard, that if you have access to healthcare, just like your healthcare have everything else in it, it should have those alternative forms of birthing, birth teams in space. And the same thing with midwives, almost that same process, speaking with your hospital first, because again, a lot of hospitals are encouraging. I mean, not so much as encouraging it, but supporting it.
Yeah, and I think the point you just made in terms of trying, that's a policy, advocacy policy issue, trying to get it written into some of the plans so that people know that those are alternatives. Wonderful comments. Everyone who's coming in is talking about how powerful the presentation has been and how very informative it is. And I just make one comment as you were talking, it really reminded me, I was born in Birmingham, Alabama. And at the time when I was born, my mother gave birth to my two sisters just older than I am and myself at home with a midwife, because in the segregated South of Jim Crow, mothers fully understood it was far safer to give birth to your children in that home rather than going to a hospital where you might have been mistreated. So I learned that, of course, in the process of growing up. But as you talked about it, it just sort of took me back. Okay, we do have a question that, what do you attribute to the number of miscarriages Black women are experiencing? That we're seeing more miscarriages being discussed more by Black women, and what do you attribute that to?
So I think there's a couple of things. One, I'm thinking there's probably always been lots of miscarriages by Black women and any other women. It's just that there was always so much shame attached to stuff like that. People didn't talk about it as much as they talk about it now. Many pregnancies result in a miscarriage. Very few pregnancies go all the way to full term. So that's one thing. And so people are talking about it more. I think that it is the stressors that many Black women have on their lives. The same thing that we talk about with maternal mortality, when we talk about weathering, years and years and years of system of oppression, and how that have impacted our bodies on the inside and how our bodies react to when something different is going on. And that's like carrying a child. And so that could possibly be one of the things. It is definitely the care that we are getting when we are getting in. I think hugely though is what we know about our reproductive health. And so how soon do we even realize that we're actually pregnant if folk don't have a real good understanding of their reproductive health? And then that kind of determines how quickly people may or may not get into care. And then the access to care. We live in a country now who don't allow folk access to care. And so when you don't have access to care, you didn't have access before you were pregnant, that could have caught things that could have that would have led to maybe a miscarriage. And then you don't have access to care after you're pregnant. And then by the time you get access to care, a whole lot of things that could have been dealt with prior to now, they've just been missed. And so it goes back to the same thing with maternal mortality. We're talking about race, we're talking about gender, we're talking about lack of access. We're talking about just like the outright denial of access to a certain community.
And I love it when you say, with all of this, what is the common denominator? Black, black, black. Another question. A person says that, Lily says that she has a client that used to doula, and her client now wants to take the training. And so the question is, do you know of a school or scholarships available for people who want to move into this field, this area?
That would be depending on where that person is at. The really cool thing, there's not a lot of cool things about COVID, but one of the really cool things is that there's lots of online trainings. And so going online, and so we were trained by ancient song doulas. They're in the New York area. That's who trained us. That's not a plug or anything. That's who trained us. I'm not sure if they do theirs online. We got ours before COVID, or she came to us. And so that's the thing, going online and finding who do it, and then doing some background on them, because you want to make sure that you know who it is that you're getting your training with. A lot of people will do a scholarship. I know for us, sometimes organizations will scholarship people. We scholarshiped about 5 or 6 people at the AFIA Center because it was necessary that those women get trained. So that's kind of with the doula piece, that's kind of thing, finding somebody that's doing it in your area, or finding somebody that's doing it online that you trust their process, and then asking them, do they have scholarships or organizations that'll scholarship you.
Okay. Okay, I think that there are 2 more questions. But again, everyone is speaking to how powerful the presentation has been. And as a Black man, I'm going to take working in intersectional solidarity to make it happen. Thank you so much for that comment. I think most of the other comments is just how informative you have been, your presentation, looking at the holistic approach to healthcare, and how are you able to, okay, that's not a question. But there was a powerful question saying, no, I think we took care of that one. A group of men saying, amen. Coach Dave said, amen to all of the presentation. So with about 2 minutes left, Marcia, any parting words or comments you would like to make? And you will have the last word. I will not come back. So let me say now what I want to say. And that is, I agree with the comments. This is very powerful, very informative, and much needed information. And I think it is so critically important that those of us who may not be in the field necessarily in terms of having all of the knowledge in the information, let's see this as a resource. That is certainly the approach by Black Health. And we don't want to say the full name, Marshall, it's just Black Health. But that is our approach, looking for those organizations who have the experience, who's doing the work. How can we support it? And how can we work with them in moving toward advocacy policy so that we can bring about needed change through our actions? So that, I think, is a key point for all of that. That said, Marcia Jones, you have the last word.
Thank you. Thank you. And I just want to thank you all again. So that's really what I want to say. Thank you. Anytime there's an opportunity for us to share with the community on things that's for the community, we are always really grateful to be able to share that. The AFIA Center is always available to sit in spaces with folk. We don't have to be leading the conversation. We're just available to sit in conversation with folk. Please go to our website and get any of the information that we have. We really want people to see our new report. We have 2 reports coming out: the State of Black Women in Texas and our Maternal Mortality 2021 report. And so we're really looking forward to people seeing that. And again, you know, just continue to connect with folk in your community who's doing work on the ground. So see, Virginia said this at the very beginning. This stuff happens when we change legislation. Like, it happens there. All of the stuff that we do on the ground, you see people going to jail, you see people laying in the street, you see people blocking off things. All of that stuff is just to get attention. The real change happens in those white state houses. That's where the change happens, when we change policy. And so do that, connect with somebody. If your legislation is meeting right now, if you're on here and you're from Texas, it's still time. We got about 40 more days. That's it. You know, try to get with somebody to get some, you know, to connect with somebody, to hook up with organizations like the AFIA Center. There's organizations like this all across the country. We always need your help. We always need your help. We need your help. We need your voice. We need all of that. And tell your story. Use social media. If you are a person, you know a person who had a bad experience with maternal mortality, encourage them to tell their story, not in a harmful way. We don't want to create trauma. So be clear about that. We don't want to recreate trauma, but we do, if they are in a place where they can tell their story so people will know that this is happening, and it's happening a lot, and getting people engaged with it. So that's pretty much it for me. I am for the better words, for the better most, talked out. I'm
Okay, and
just
I
super
said you
excited to
had
be
the
here.
last word, but I do want to remind everybody to please complete the evaluations, because the evaluations help organizations as Althea Center, Black Health, to continue to do the work that we're doing. And it helps us to tell our stories through you. So please complete the evaluation. It is up on in the chat in terms of www.surveymonkey.com/r/BMHI, but you can see it there in the chat. Well, we thank you, everyone. We thank our participants, and most importantly, we thank our presenters, Sarita. And Sarita, did you have any last word, or Evelyn? And I certainly want to thank Evelyn Botwe of our staff, who has been managing all of this from our end. And she too is a growing star, as you talked about, Sarita, earlier, Marcia. We have Evelyn in that space. So we are really grateful for these young women stepping up, because we are stepping on.
Let me tell you.
Okay, thank you, and thank everyone for joining us, and have a blessed rest of the day. But please make sure that you complete the evaluation. And thank you, Marcia. Bye-bye.
Thank you all. Bye-bye.